Hi, and welcome to another episode of HOCTV. Today, we will be talking with Dr. Chilka. Thank you, Dr. Chilka, for joining us. So, Dr. Chilka, tell us a little bit about yourself.
Well, I moved to Midland from India back in 2000. I did my residency at Texas Tech in Midland, Odessa area. So I've been in the Permian Basin for a total of 13 years so far. And I've been in practice for 5 years and going on. So
Fantastic.
I had just finished my med school back in India. I was ready to take my steps, my USMLEs, and that's how I ended up. There's a great program right here in the Permian Basin. So I ended up applying to it, got into it, and graduated, and we like the place. I guess they say once you're in West Texas, it's hard to move out. So we've been here, and then of course we wanted to. My husband, Dr. Gant, is already practicing here, so we just wanted to continue the care that we can give to the community, and that's how we just stayed on, and I'm really glad that we did.
How did you come about this practice?
Just to combine our services and to give a more comprehensive care to the patients, we decided that having one location where we offer a multitude of services, like we do x-rays here in the location, we do an ultrasound, we have a full-time, I would say she's available at all times, but she's a certified ultrasound and an x-ray technician, so we have that. We have our own bone density machine. So just to combine our services and give a more total care to our patients, we decided that it would be good to have one location, and that's how we ended up choosing this spot. That was, our practice does have a significant proportion of geriatric population, so we try not to inconvenience them, try to kind of, it really helps us give the best care for the patients. Suppose somebody is having a fall and they come here and they're like standing in the ER waiting and trying to get in to see the doctor. It takes a few hours. So here at least we can at least do preliminary care and say, okay, yes, you have a fracture, no, you don't have a fracture. And the good thing is we have it's telerad, so we have the images and they're transmitted to the radiologist. So we can do more prompt service to the patients without having to put them in like a dilemma of what's going on with me, what do I do, where do I go next. So It does help that way too. And then plus we have an in-house lab also, so if we have to draw some blood and send off something right away, we can do that. Our goal is to take care of the patient in the best way possible, and that's why we slowly, we didn't start off with all these services, we just kept adding them on as we felt the need for it. And I'm glad to say that it's all working pretty good. At least from what we expected for the patients, it's satisfying our purpose.
What can patients expect when they come for an appointment in your office? What can they expect through the process?
Well, as with all primary care, we try to focus on the entire patient, not just one problem. And a lot of our patients do see other physicians for cardiology, neurology, and other reasons. But when the patient walks into our office, we hope to kind of be the first to-go point, put together all the help that they're getting from the different doctors and try to provide a more safe approach for them. We try to be their doctor to go to for any kind of problems. Of course, we treat the usual coughs and colds and aches and pains and stuff like that, but we also want them to think of us when they don't know where do we go, so that they come to us and we can address their issue first and then send them to the appropriate doctors, or at least, or maybe even take care of it ourselves. When a patient walks into our office, we want them to be very comforted and reassured that yes, I'm going to a place where my problems will be solved, or at least I'll be sent to somewhere that can take care of my problems. So that sort of confidence is what we want. And of course, in my practice per se, I have like over 75-80% is the diabetic population. So I strive to really get them the best care possible at least not that I don't treat high blood pressure or COPD or asthma or anything like that, but it's just a good chunk of my population is diabetic. So my goal is to give them the best medication possible for for getting the disease under control. And it also helps that we do a lot of diabetic research, clinical drug research with us. So we've done several clinical trials from different companies, whether it's, and that kind of gives us a little bit of an advantage where you are able to see a first-hand use of a drug before it's out there in the general population, or even if it's in the general population, they're just trying to study the different ways in which you can use the drug. So it gives me an added advantage where I'm more comfortable using the newer drugs in the market for diabetes, so that our patients get the the best care possible and get their sugars under control. And we have a lot of guidelines for the diabetes. You have to give A1C sugar less than 7. You have to have annual eye exams, annual foot exams, everything. So our goal is to make sure that everything is done on a timely basis.
Right. What is the best way for a patient to schedule an appointment with at your facility?
We have.
Do you have a website?
Well, no, really. We have an application package for a new patient that they can always pick up at the front desk, or it can be faxed to their location. We do screen our patients before we give an appointment, so the applications are brought to the doctors and we go over them, and then we make sure that it is the right fit for our population base, and then they get the appointment.
Fantastic.
It's a very simple process, really.
And do you have a phone number that you'd like to give our viewers so they could call and get and an address so they could pick up those packets? So
yes, our office number is 432-686-0000, and we are located at 3401 Greenbrier in Midland.
What are your thoughts with working with Hands of Compassion? How would you rank us, rate us?
Definitely, we've had. I have several patients of mine are under your services, and I have always had no problems whatsoever. I've always been able to pick up the phone and talk to anybody, the nurse or the coordinators, if I had any concerns with patients. I believe strongly in home health, especially, like I said, because I have a little bit of a tricky population with the diabetes and the elderly. So I do rely on the staff a lot to get back to me if there's a problem. So I've always had good feedback from patients with your care, and have not had any major complaints whatsoever. So I'm happy with the services, and I would strongly say yes, it would be one of the top agencies to send your patients, if they need home health.
Well, thank you very much for that. We appreciate it, and we enjoy working with you as well. That's it for this episode of HOCTV, and thank you again, Dr. Chilka, for joining us, and you'll have a great day. Thanks.
Thank you.